am part of Healthcare Workers Fo Palestine Bay Area. I am a physician in palliative care, where we care for people who have serious illness and are sometimes at the end of their lives. We are here today as healthcare workers here in front of San Francisco General Hospital in solidarity with healthcare workers and people of conscience everywhere, globally, who are witnessing this forced starvation of Palestinians of all ages in Gaza, and saying enough. It has been enough many years ago, but really enough. We're here to say, stop arming Israel. We're saying, allow aid in fully and unconditionally. And we're saying to our government to stop its support and active complicity in the genocide of the Palestinian people. As healthcare workers, the oath that everyone knows is like, do no harm, right? Do no harm. And part of doing no harm is to speaking up when there is harm done. And particularly when there's harm done that includes affecting people physically and emotionally and affecting the healthcare system. I'm a physician. I get to work in different hospitals with beautiful, dedicated nurses and social workers and chaplains and all kinds of healthcare workers. And our colleagues in Gaza, who are healthcare workers, who have been continuing to work to try to save lives and alleviate suffering they see for 2 years under genocide, they are now collapsing because they are starving too, right? And so as a healthcare worker, I see that. I see my colleagues who are me, who are you, who are all of us, who have done nothing wrong but to stand up for the dignity of all people. I see them collapsing. And I see people of all ages. I see babies denied formula. I see babies denied food. I see people of all ages denied medical care, the simplest medical care. Our patients here are getting dialysis today. Palestinian patients not getting dialysis are dying because of renal failure. That is not okay. And it's very troubling. It's very troubling that our medical institutions are silent on this, and silence is complicity. I think we want every single medical institution to develop the moral courage that healthcare workers like us all, like everyone here has, to stand up and say, stop the starvation, stop arming Israel, allow aid in, right? And every medical institution needs to be doing that. We just happen to all work at SF General, and so we are here as part of our lunch break, as part of responding to a call by another organization called Doctors Against Genocide that said, everyone come out during your lunch breaks every day to sing, scream, chant, to let aid in.
My name is Brenda Barros. I work at San Francisco General. I've been here 45 years. I'm here in support of the people of Palestine today because I see all the pictures. I see all the children. When I see those kids, I think about my grandkids. And the way what's happening in this country, what's happening to Latino people, it's all the same to me. As I said in the beginning of this is no different than what happened to black people in apartheid South Africa. And now we're letting it happen again. And it's almost getting to the point where it's almost like Hitler's Germany, the way people are thinking, the things you hear coming out of people's mouths, and somebody has to stand up for the people.
And they're spending so much money, U.S. taxes, for Israel. What do you think about why, and the politicians, the mayor, the senators are supporting it? This is in California.
Well, it's about greed, right? The Democratic Party is not Republican. It's people with money want control. They want the world to look a certain way, and they're willing to do anything, apparently, to get it there.
What can unions do about it?
Well, unions need to step up. Union needs to educate their members and speak up and put their resources behind fighting for the things that we should be fighting for.